Hey everyone, it's Sebastian. I'm going to cover our 3-point movement compensation assessment we do here at Performance Place for athletic pubalgia or sports hernias. Now the reason why we do this is to identify how your body is compensating with really simple movement. And so the 3 tests that we're going to use is number 1 is a really basic squat. Body weight squat. Number 2 is we're going to use an overhead movement. We're going to use a wall just to keep ourselves honest. And number 3 is going to be a single leg hinge. All of these shouldn't hurt, but also they should kind of look generally normal-ish. If you notice that it's hard to actually get through full range, or if you notice that there's a side-to-side issue, or you're cramping, or things tend to tighten up in areas where you wouldn't expect them to, those are all signs of possible movement compensation. We also have another assessment that we use to figure out, is there high risk of re-injury? They're not movement compensations per se for all of them, but they identify more passive ranges of motion in areas that could be stiffnesses involved. This one doesn't identify stiffnesses. This identifies how your body may be using those stiffnesses. So different tests for different purposes. So the first one is going to be a squat. I'd say for this one, most people tend to mess up with the basic starting point with the stance. Okay, so I want to make sure that you stand with your feet generally shoulder width apart and toes, the second toes here, facing directly forward. Now most people will tell me, this is not how I squat. I usually squat like this. Right, I'm not testing your squat, I'm assessing your squat pattern. And so we need to keep things standardized. And this makes it so that your body doesn't have ways to get around some of the compensation that it may be using. So we're gonna make sure that our toes are facing directly forward and the feet are physically glued to the floor the entire duration of the assessment. We're going to go hands behind the head, elbows forward, and sit as deep as you can. Okay? Ideally, you want to be able to get through as much range as you can to figure out if there's anything changes. And I would suggest that you videotape yourself doing this. Now, you guys may be able to see with me, I do certain things too. Does one knee kick out further than the other? Do I drift to a certain side as I descend? Does one foot really want to turn out? If I go from the side here, am I leaning forward like that to accomplish it, or can I stay upright? Okay, so all of these are things that I would assess, okay, and track. They don't mean that you can't get back to your sport again, but they are things that you should strive to improve over time if you can. The next one, we're going to need something like a dowel. We need to be against a wall to assess it properly. And the reason why we use a dowel is because that people tend to not know that they just extend their back on this one. So we want to see if the back starts to move before you can touch quote-unquote normal range. You may notice that actually one side moves a little bit further than the other two. And we're testing to see in this whole process here, this movement, can the thumbs touch here without flaring your elbows away? So can you keep your elbows generally together? Like if you had a foam roller attached to both, you wouldn't drop it. But we want to see how the shoulder couples with the mid-back and couples with the low back too. In simple terms, you can say maybe the lats pulling on the low back, but there's much more to it than that. So I wouldn't really hang your hat on that necessarily. But what I'm going to do here is I'm going to go into a deepest squat that I can tolerate here for like about 10 seconds. For some of you who are having pain doing this, you can do it on the floor, but it doesn't necessarily carry over to body weight as much. So it's going to be here, and you go up, 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 and see if you can touch. Okay. So I'm able to keep the stick steady while my mid-back and my thumbs touch, but it's really hard at the top, okay? If you really needed to and you couldn't be in this position for too long because your hip actually hurts, you can do it like here in a more of a standing position, but I would bend your knees because it can be really hard to pin that against the wall if your knees are locked. So you can go here and pin it and then do the same movement. Now the last of the compensation assessment is going to be a single leg bridge. The single leg bridge is a hip dominant strategy, so it's going to be using your posterior element, the backside element, the glutes probably, to do something called a bridge. We're going to make it a single leg bridge because it makes it a little bit more challenging, and it tends to make the compensation arise a little bit quicker versus going through a bunch of reps. So what we tend to have people do is go here and see if they can push their hips into the sky and down. As long as your foot is raised, I'm okay with it. If you want to go up to here, you can too. For some people, this is a no-go because of other issues, but you can make sure you're only really using one leg to do the exercise. Go as high as you can and low as you can. High as you can, low as you can. Now you notice that I've, done 4 or 5 of them now. I'm not really dying yet, okay? Number one, if you physically can't perform 10 reps, this is something that is really deficient, okay? So it's something that you can work on and get better at, and it's just really more of an issue of exposure. Now let's talk about the other things that would make this thing more positive in regards to its finding. So if I start doing this, and you see that rib cage start to pop up that we talked about in some of the other videos with central stabilization, this is a sign that you're compensating with the open scissor extension, compression, stabilization strategy. It means that your internal pressure is poorer, and then you're using a lot of the bony structures of your low back and then tilting your pelvis forward to help stabilize, okay? Now, so that's one, just recognizing that that is a compensation is really the only goal of this. We're not solving this right now, okay? The other thing is noticing that your low back feels tight. The other thing is going to be cramping of the hamstring, okay? All these things indicate that you could improve on this. Some of them will resolve out of a hip dominant strategy, just regressing something like this. Other things will improve with coaching intra-abdominal pressure. Other ones can improve with just doing the exercise. Identifying and writing down your results with the tests and tracking them over time can really help out to figure out how you're compensating, and is your rehabilitation program actually breaking this compensation or not. While we can focus on pain, pain is not the only thing that we need to be focusing on. How your body loads, how your body navigates workload that it is exposed to in daily life and sport is really important. And you can use simple exercises like this or squatting or things like that to figure out how your body's compensating, okay? Thanks for watching the video. I'll see you next time.